Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and County Executive, I'll hand things over to you to get us started.
Well, thank you so much, Catherine, and good afternoon to everyone who is joining us. So today I want to get started with the Milwaukee County vaccine mandate update. And I'm excited to share that as of this past Sunday, December 12th, 96% of Milwaukee County employees that were subject to our COVID-19 vaccine mandate are vaccinated or have received some type of exemption. And so for reference, 96% equates to 3,366 Milwaukee County employees that have been vaccinated or have received an exemption. And of that 96%, 87%, 3,055 employees have been vaccinated. So throughout the COVID-19 pandemic, county leaders, we really prioritize policies that reinforce our vision to become the healthiest county in the state of Wisconsin. And we know that these policies have worked. Approximately 15% of staff who submitted proof of vaccination received their first dose after the mandate was put in place. And so Milwaukee County's employees' vaccination rate is encouraging. And it should be a signal, a sign to the broader community about how serious we take the health as well as the well-being of all of our employees and those that we serve throughout the county. And racial equity was a key consideration throughout the development of the county's vaccine mandate. The consequences of COVID-19 have had an inequitable impact on vulnerable groups. And this includes Black and Brown people who tend to be more at risk of severe illness as well as death from COVID. And this is another reason why preventing further harm to these communities was a primary consideration in establishing our vaccine mandate. And so Milwaukee County, we're committed to providing a workplace that is safe for all people. And this includes the individuals Milwaukee County employees serve. And so to put it simply, increasing the vaccination rates among employees helps keep everyone safe. And as we see the Delta and Omicron variants continue to cause concern nationally, I highly recommend that everyone receive their booster shots and continue to prioritize the health as well as the safety of themselves and others. And so while we are all celebrating this achievement, we clearly know that our work is not done. And we still have a ways to go in getting more people in our community vaccinated. And as we see the holidays are quickly approaching, we know that getting vaccinated as well as boosted is one of the most effective tools that we have out there. But there are also important mitigation measures that we also have to continue to keep in mind. And so whether you're gathering with your friends, your family, your coworkers, or shopping at a crowded store for your loved ones, I want to remind everyone that practicing the 3 Ws, something we haven't talked about in a while, the 3 Ws is critical to maintaining the safety of yourselves and others. And that's wearing a mask, that's washing your hands, and watching your distance. And so please keep these measures at the top of your mind so we can also continue to enjoy the things that we love about the holidays. But just know that it's going to continue to look a little bit different. But also please remember that if you are not feeling well, get tested so you don't spread the germs to your loved ones this holiday season. And you can find a trusted local vaccinator by visiting the website healthymke.com. Again, if you need to get tested or find a vaccinator, please visit healthymke.com. Again, thank you so much for joining us this afternoon. And with that, I'd like to hand it over to Mayor Tom Barrett. Mayor Barrett.
Well, thank you very much, Mr. County Executive, and good afternoon, everyone. The County Executive began his discourse by talking about county employees, and I'll do the same. I'll talk about city employees. And it's not as though we have a friendly competition here, but I just have to point out to the County Executive that I think we inched them out on this one. And I do mean inched out because I announced in August that the city of Milwaukee would be implementing a vaccine mandate for general city employees. Again, we're talking general city employees here. We're not talking about our protected services, and I'll touch on that a little later. But the deadline to produce proof of vaccination was the end of October. And I'm pleased to share that we have seen a high compliance rate of 97%. The county executive said the county was at 96%. So we inched them out. It wasn't a competition, but I just have to point that out to my friend. Exemptions were made for employees based on religious or medical reasons. And as I also stated, this applies to general city employees. It does not apply to protected services. We've reached an agreement with our Milwaukee Police Supervisors Organization on masks and testing. And we are working through the collective bargaining process with the other unions, the unions that represent the Milwaukee Police Department and the union that represents the Milwaukee Fire Department. But for those individuals who are general city employees who have chosen not to get vaccinated and did not receive a religious or medical exemption, we are now beginning disciplinary action for non-compliance, which may include dismissal. Fortunately, and I mean this, fortunately, this is a very, very small number of employees. I hate to see anybody lose their job over this, but we have had such tremendous compliance because I think people recognize the stakes of what we're trying to do here. Our Department of Employee Relations provided educational materials, it provided on-site vaccine clinics, and up to 2 hours of paid leave to employees to receive the vaccinations. And again, the vast, vast majority of our employees took advantage of this opportunity or on their own time got vaccinated. So I am grateful for all the work that's been done by our Department of Employee Relations, by our health department, and our employees so that they can successfully implement this mandate. So the obvious question, and we've been over this for months now, is why are we doing this? And all you have to do is look at the numbers and you'll understand why we're doing this. And that's why I want to talk a little bit about the gating metrics. Unfortunately, we remain in the extreme transmission category for COVID-19 cases per 100,000. We are up to, and I hate that phrase, up to 326.5 cases per 100,000. And our percent positivity rate remains in the high transmission category at 10.6%. We have, as I noted last week, now past that 60% threshold with 60.4% of city of Milwaukee adults, individuals 16 or older who are fully vaccinated. That number is still, from my perspective, way too low. I look at a lot of other cities around the nation that have a higher number. We're working toward that, and I'd like to see more progress there. And 65.4% of adults have received at least one dose. In addition to receiving a first or second dose of vaccine, residents should also seek booster doses to better ensure protection from COVID-19 and the new Omicron variant. Currently, over 76,200 booster doses have been administered to City of Milwaukee residents. So we've had a lot of people that want to get that booster shot. Announced just last week, 16 to 17-year-olds are now eligible for Pfizer boosters, in addition to those 18 and older. It's hard to believe, but it's now been a year since the state first started implementing a vaccine program. So today, Governor Evers and the Wisconsin Department of Health Services marked the 1-year anniversary of the first COVID-19 vaccine administered in the state. We continue these vaccination efforts a year later, following the science and administering shots to protect people from serious illness, hospitalization, and death. One of our most recent efforts, our school-based vaccine clinics, concludes today. As we get closer to the holidays, we know the schools are going to be out for Christmas and New Year's and Kwanzaa. And so we wanted to make sure that we were doing everything we could in these first couple of weeks of December. The clinics were a partnership with the Milwaukee Public Schools, with the Seton Catholic Schools, and Children's Wisconsin. They began back on November 8th. The clinics were planned to allow 10 days after second doses prior to the Christmas holiday and 2 weeks before the New Year's holiday for children to reach their full immune response. To date, 2,179 total doses have been administered to children and adults at these clinics. This excludes today's clinics, the last day of the partnership. The health department expects at least half of the vaccines were given to children alone. And again, we want to get our kids vaccinated as well. So let's look forward. We know the New Year's coming. The health department will be offering vaccine clinics this week at Ascension All Saints Family Health Center at the Milwaukee Academy of Sciences, St. Anthony's, and Munn Consortium at St. Michael's Church. So as we all start planning more family events, this is a great, great, great opportunity to make sure you get your first shot, your second shot, or your booster before you have visits with friends or family over the holidays. A full list of vaccination sites can be found at milwaukee.gov/COVIDvax and at healthymke.com. And with that, I will turn it over to Dr. Weston. Dr. Weston.
All right. Thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 389 new cases per day, and now unfortunately rising about 3 deaths per day. As a country, today we reached 800,000 Americans that have died from COVID. 1 out of every 100 Americans over the age of 65 has died from COVID, and we continue to see another death every minute nationally. Our trends continue in the wrong direction. Cases continue to rise both locally as well as statewide, as do hospitalizations. We now have 339 people hospitalized with COVID in Milwaukee County, and that's a number we have not seen in nearly 12 months of data. Statewide hospital beds remain extremely constrained, and we're seeing emergency departments backed up with longer and longer wait times. More than 1 in 3 ICU beds in the state is currently occupied by a COVID patient. That's leading to only 4% of ICU beds available in the state, and large regions, including the entire Fox Valley, with 0 ICU beds available. 0 ICU beds available. So as hospital capacities become more and more constrained, it remains as important as ever to use emergency departments for true emergencies. And that does not mean routine COVID testing. We have quick, easy, and free COVID testing sites across the county, far faster and far cheaper than the emergency department. So please don't use EDs for routine testing or confirmatory testing. A positive test is a positive test wherever it came from. So you can get a test collected in 15 minutes at a pharmacy or a health department, or you can wait 8 hours or more in an emergency department to get that same test collected. So make the right choice. In other news, booster guidance has been updated. Now, anyone age 16 or older can and really should get a booster if they're 6 months out from Pfizer or Moderna's second dose, or 2 months out from their Johnson & Johnson dose. And there's very good evidence for this. Data out of Israel in particular was published just last week in the New England Journal of Medicine. And it showed when you compared people who've received both doses of vaccine to those who've received both doses plus their booster, those who were boosted were 10 times less likely to get infected with COVID. They were also 18 times less likely to get severe infection, and that's across all age groups. And when you look at those most vulnerable, 60 and older, the boosted group was also 15 times less likely to die from COVID. I mean, these numbers are really quite staggering. The vaccine is very effective, but the protection that's added from that booster is really critical, especially now considering our disease burden in the state and in our community. Getting boosted is safe and easy and free. And side effects, remember, are about as common as the booster as they are from the second dose of the vaccine. And as with that dose, if you get these side effects, they'll last about a day and then they go away. And you can go to healthymke.com to find a site near you, including many walk-in and drive-through sites like those at the Milwaukee Health Department. No appointment needed. You just walk up, you get it, you're done. Next, the latest on Omicron. It seems to certainly be extremely transmissible, much more so than the Delta strain that we've seen most recently. It's rapidly becoming the dominant variant in the UK, for example, where cases are rapidly rising and are just about ready to eclipse the number of cases at any other point that they've seen in the pandemic. The latest data out of South Africa suggests that while the vaccine has lower effectiveness against infection from Omicron, it still is highly effective against severe infection, as well as hospitalization. So we'll follow in the tracks of the UK. There's no question. In the coming weeks, you can prepare to you can prepare for this by certainly getting vaccinated, but also by getting boosted. And we'd certainly expect the booster to provide even stronger protection against Omicron. Now, I want to transition and talk for a moment about masks. I think it's time to rethink masking. And to be clear, not whether to mask. That conversation is long over. But with the disease burden where it is, and the Omicron variant in our community, everyone should be masking inside when in public settings. Now, what type of mask should you be wearing and why? I like to think of it as the 3 F's of masking: filtration, fit, and function. So first, just to preface, let's keep the face shields, masks with those little valves, and the gaiters or scarves out of the conversation. They just really don't work well. So let's start with the first F, filtration. A single layer of cloth is not as good as a double layer of cloth. It's not as good as a disposable mask, which isn't as good as respirators, such as KN95s or N95s. In general terms, you can think of cloth masks somewhere between 25 to about 50% protection. Disposable masks, you get in the 40 to 80% range. And then KN95s and N95s are about 95%, as their name implies. Now, these percentages, though, have a lot of variation, and there's a reason for that, and that gets to the second F, is fit. So when you think of fit, you want a fairly good seal to your face. If a lot of air is escaping around your mask, around your nose or your chin or the sides, it becomes a lot less useful. It's like wearing goggles underwater without a good seal. You're going to get wet. But no matter the type of mask, there are better ways to ensure that it fits. Always use a mask with one of those nose bridges that you can tighten around your nose. If it's loose, you can tie knots in the ear loops or twist the ear loops to get a snugger fit. And you can wear a cloth mask over a disposable mask to help hold it more against your face and minimize those gaps where the air can escape. And then there's the best option of all, a nice fitting KN95 or N95 masks. These masks are technically called respirators, tend to form more to your face, but they also have excellent filtration. And they're also typically made of polypropylene. Some other masks are too, but polypropylene can have an electrostatic charge. Think of when you rub a balloon against your head to make your hair stand up. This charge helps to catch particles so you don't breathe them in. So if you go the KN95 route, you want to make sure that it's a legitimate mask. There's a lot of counterfeit KN95s out there. There's a website, projectn95.org. It's a great resource for finding good, high quality, and well-tested non-counterfeit masks. That's projectn95.org. And then function, lastly. You want to make sure that the mask you're going to use is functional or usable and not going to be removed often due to discomfort. You're not going to want to wear a true fit-tested medical grade N95 all day long. I can tell you from lots of personal experience, your face is not happy after wearing one of those masks for 8 hours. So you want to find a mask that fits you well, has good filtration, and is comfortable for hours and hours of wear. So I'm often asked what I wear. Well, personally, to be honest, there's not many situations that call for a mask where I wear a simple cloth mask anymore. If you like the feel of cloth, though, you can go with one, certainly with an aluminum nose bridge, but also there's these filter inserts. And then you can get the best of both worlds, a good, comfortable fit with the added filtration. If you like the convenience of disposable masks, go with one that fits well. And if it doesn't fit real well, consider a cloth mask on top to help with that fit. I'll tell you my favorite mask, and no conflict of interest here. It's just a mask that fits me well. It's relatively cheap. It lasts for quite a while and is easy to find. When I have to go into a crowded place indoors for a longer period of time, I like a KN95, and I like the Polycom KN95s. It comes in white or black. There's kid sizes. So with disease burdens where they are right now, what we're seeing, and the rise of Omicron, it's time to really up your mask game. So remember those 3 Fs. How is your filtration, your fit, your function? What masks have you found that you like, that work well for you? I started a thread on Twitter. It's at Ben W. Weston about this. So share what mask you found. Tell other people what you think works well and what's been comfortable for you for longer times when you need to wear one. So none of us enjoy wearing a mask, but it's something we have to do right now for ourselves and for those around us. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As of exactly 1 year ago today, the Milwaukee Health Department has administered nearly 205,000 doses of the vaccine at mass vaccination sites, community events, places of worship, schools, in residents' homes, health centers, and more. We so appreciate our community members who have stepped up to protect themselves and their loved ones, and we are grateful for the MHD team and community partners who work tirelessly to bring free and accessible vaccines to the city of Milwaukee. As we talk about new emerging variants of COVID-19, it's important to remember we've learned a lot over the past 21 months and have gained effective tools to fight this virus. The vaccine is still our strongest tool to protect against Delta, Omicron, or any other existing variant. Vaccines and boosters are free and easily accessible at any of our health department sites. At this point in time, the CDC and we recommend that everyone 16 years of age and older receive their booster. The only qualification for a booster at this point is if you are 16 years or older. If you are fully vaccinated, 16 years and older, and at least 6 months past your second dose of Pfizer or Moderna, or 2 months past your dose of Johnson & Johnson, you should get your booster today. Those who are 16 or 17 are currently only eligible to receive the Pfizer vaccine and booster, but adults 18 years and older can get any of the COVID-19 vaccines that are authorized in the United States. The Milwaukee Health Department sites at the Northwest Health Center, Southside Health Center, and Menominee Valley Drive-Thru have ample supply of all 3 COVID-19 vaccines, and no appointment is needed. It's quick, it's easy, and it's free. Our hours and locations are on our website at milwaukee.gov/COVIDvax and healthymke.com. According to data just released from Wisconsin DHS, about 15% of children ages 5 to 11 in Milwaukee County have received their COVID-19 vaccine. I am so heartened to see Milwaukee's brave kids roll up their sleeves to get their shot. Whether it's school vaccination clinics, Pfizer Forum Clinic, or health centers, the strength and resilience of our kids has only been further highlighted when they roll up that sleeve and sometimes cry, but actually get their shot. Watching them conquer their fear of needles to protect themselves, as well as their parents, siblings, grandparents, and teachers, has been incredible. I know there are still quite a few parents who are nervous about vaccinating their children. Every parent, myself included, wants to make the best decision to protect their kids and to keep them safe and healthy. It can be scary and nerve-wracking to make these decisions when you don't feel like you have all of the information. I encourage anyone who has questions about the pediatric COVID-19 vaccine to speak with your trusted pediatrician, ask questions, and get direct and informed answers. The vaccine has gone through the clinical trial process and has been reviewed by the FDA and CDC, and they have deemed the vaccine safe and effective at protecting against the virus. It's the best tool we have to keep our kids safe, especially as we head into the holidays and spend more time indoors because of the colder weather. As many people have already begun to plan and attend holiday gatherings, we encourage you to celebrate safely. This means wearing a mask when you're in crowded public indoor spaces, regardless of your vaccination status. An active vaccine policy for friends and family members invited into your home, and only gather with people who you know are fully vaccinated. And if you start to experience COVID-19 symptoms or know that you've been exposed or been in contact with someone who's tested positive, get yourself tested, stay home, and celebrate virtually. We all want to experience a normal holiday season this year, but we're still in a pandemic and our COVID cases continue to increase. Please, please continue to be diligent and safe. Thank you.
Thank you, Commissioner Johnson. I am seeing a handful of questions in the chat already. The first one coming from Rich Ravita with Milwaukee Magazine. He says, for anyone on the line, yesterday, the city of Milwaukee set another record for homicides in a calendar year, a trend that is plaguing many cities across the country. Do you believe, or is there specific evidence that the pandemic has played a role in these rising numbers?
Well, there's no question that we're seeing more violence in the city of Milwaukee, and as the question notes, throughout the nation. And it's very, very, very challenging. And I think all of us, all the policymakers, I think community leaders, people in the community recognize that this is a serious problem. Is there a correlation? I don't know. I'm sure that there are many who are studying this, but I think it is striking that the 2 years where we have seen the highest number of homicides in the history of this community are the 2 years when we have the pandemic. It has had a huge impact on people's lives, obviously their mental health, their economic health, their physical health. So it's been a challenging time, no question about it.
I would echo the same sentiment when we think about COVID-19 and not only how is it affecting the city of Milwaukee and Milwaukee County, but how it's affecting other municipalities across this country. You know, the only thing that we do know that's been going on at the same time has been this pandemic. We've seen the rise in emerging mental health costs. We've seen the rise in drug overdoses, and I think other communities, and I've actually had this conversation with other county executives across the country, that they're seeing the exact same thing. And so, you know, I think the science is still out on this. And as Mayor mentioned, I think people are going to be studying this, but I do think that, you know, there's a lot that we can say that this pandemic has been contributing to for the past 2 years.
Our next question comes from Melissa Zagowitz with CBS 58. She says, today marks 1 year since the first vaccine was given in Wisconsin. Did you think we would still be here today, or did you think the pandemic would be more under control?
I think we all thought and hoped that this would pass. If there's one thing I agree with President Trump on was when he said this thing will be gone by April. Obviously, I wanted it to be gone by April of 2020. I didn't think that was a responsible statement, but I don't think anybody dreamed, at least I didn't dream, that we'd be now well over a year and a half. And maybe Dr. Weston or others feels differently, but I just assumed that we would get this under control much earlier than we have.
And I would say that I think that we all wanted to get this under control. But this is something that we've never experienced before. We haven't seen a pandemic like this in over 100 years. So it's kind of hard for us to say what we should expect and what's going to happen within the next year. But what I will say is that if we're going to get over this pandemic, we have to get as many people vaccinated and get boosters within those arms, but also make sure that we are following all the mitigation strategies that we continue to talk about. Wearing a mask, washing your hands, and watching your distance. But yes, I wish this would have been gone, but it's kind of hard to have expectations like that when you don't know what you're dealing with.
Yeah, I would agree. I think, a year ago, we saw the vaccine development come through and we saw people start getting vaccinated. And we had what was and has continued to be really a silver bullet for this pandemic. It's a vaccine that's incredibly safe, safer than just about any other medication out there. And it's a vaccine that's incredibly effective, not just at preventing severe disease, but even at just preventing infection. But I think we saw a lot of resistance to the vaccine. We saw a lot of politicization of the vaccine. And we've still continued to see a lot of inequity of the vaccine, whether it's local inequity, certainly national inequity. Maybe most impactful on the pandemic is global inequity. Countries that are still in the single digits or even lower than that for vaccination rates. So as long as that continues, I think we'll continue to be in a pandemic.
Our next question comes from Kent Wainscott with WISN 12. He says, for Dr. Weston, or I know Commissioner Johnson, you spoke to this. The question is, the new DHS numbers out today show 10% of 5 to 11-year-olds are fully vaccinated and less than 18% have had one shot. And a national survey shows 2/3 of elementary parents have some vaccine hesitancy for kids. Is there enough being done to convince parents of the need to vaccinate their children?
I don't know, Kent, that there's ever enough being done. I don't think there is until a much larger segment of the population is vaccinated. We've seen, I think it's 0 cases of myocarditis. That was one of the concerns. That's one of the hesitations parents had. But again, we see a very safe vaccine. We see a very effective vaccine. We don't often see kids getting really sick, but we certainly do. We also see long-term symptoms of COVID in kids. We also see the Omicron variant, which from South African data seems to be making quite a few young people sick. So I think we can continue to do more and more and really never enough to talk about how safe and effective this vaccine is and get more people protected and get our community protected.
Our next question comes from Eric Gunn with the Wisconsin Examiner. He says, for anyone on the call, on Monday, The Atlantic published on its website an essay whose author wrote, in the words of the headline, where I live, no one cares about COVID. Whether or not you have read that essay, do you find that attitude widespread in our community and state? And how do we as a society respond if so?
Well, I think that we all recognize that there are some people who take it very seriously and there are other people who don't take it seriously. And I think those who don't take it seriously fall into a couple different camps. One are the people who I would say are eternally optimistic and are just going to make believe that there's nothing wrong and just want to live their lives. And they might be successful and they might be able to get through without being affected. Then there are those that Dr. Weston talked about, I think, who are subject to the misinformation or just the downright bad information that this is something that we should not take seriously. I will say I am surprised at times when I'm in events with a small percentage of people who are wearing masks. It's not something that's easy to do. Nobody likes to do it. I don't like to do it. But I think that to me is somewhat troubling. And I understand, I think there are a lot of people who felt a year ago at this time that we were making a deal. The deal would be you get the vaccination, you don't have to wear the mask. And that was a pretty good offer. And a lot of people took us up on that offer. But again, we see now a year later that we still have challenges. So there's no question that we are a divided nation on this. But it's not just in the United States, it's around the world that that there's a sharp split on this.
I'm not sure what more I can really add to that. I think Mayor Bear really hit it on the head. But I guess the one thing that we can do is continue to thank those who always take this serious, who always watch their mask and hold other folks accountable, particularly in public settings when we are congregating as a society. And so, at the end of the day, we can't continue to politicize this message. We have to do everything that we can to protect one another. We can't have a healthy economy if we don't have a healthy community. And I know everybody is ready to get back to normal. And so it may, I would say that sometimes it may determine on household, it may determine on different counties or different states on how serious people take it. But at the end of the day, we have to continue to have these crucial conversations about how we have to lean on one another to get over this pandemic.
Our next question is for Mayor Barrett. It comes from Melissa Zagowitz with CBS 58. She says, Mayor, Milwaukee has submitted a bid for the 2024 Republican National Convention. Why is Milwaukee a good place to hold it?
Because we're a swing state and everybody's going to be coming here in 2024 from both parties. I think that we are a very, very wonderful place to visit. I think all 12 months, but it doesn't get much better than Wisconsin and Milwaukee in the summertime. And we're great hosts. So I think it would be a great spot. I'd love to see us run the table and get the Republican and the Democratic convention in 2024. That's going to take a lot of work, but I think it'd be great for our community.
Our next question comes from Chuck Kornbach with WUWM. He's looking for a little bit of a teaser for tomorrow. He says, are the First Lady and Surgeon General bringing any helpful news on the COVID front when coming to Children's Hospital tomorrow?
Well, I haven't heard any news as far as what they're going to be bringing, but my hope is that as we continue to talk about getting the vaccination in young people's arms, particularly our kids' arms, hopefully we can see an uptick within our young people across Milwaukee County, across this state when it comes down to getting the vaccination. So I'm extremely excited to have them coming into Milwaukee County, visiting Children's Hospital or Children's Wisconsin, but hopefully we can have a deeper conversation about how we encourage people not only to get the vaccination themselves, but also to get their children as well.
Thank you, County Executive. The last question I'm seeing in the chat comes from Taylor Lumpkin with TMJ4 for Dr. Weston. She says, how do we combat these high hospitalization rates across Wisconsin? And what may happen if these rates continue to go up?
Well, I think the way we combat them are really twofold. So one is mitigation measures. We know how people get COVID. It's through close contact with others, through droplets or aerosolizing particles. So the way we prevent that is we wear masks, we wear high quality masks, like I talked about. We keep distance and we ventilate as much as we can. Those are the mitigation measures that we know of. Now, the other big step is vaccination, whether it's first dose vaccination. Certainly everybody should be vaccinated at this point, but also boosters. Be sure to get your booster if you're due. Only about a third of people in Milwaukee County, a little more than that, who are eligible have gotten boosted so far. So we know there's a lot more people who can get boosted. But without a doubt, our hospitals are filling up. Our hospitals are full. And so there's not a lot of wiggle room to have more and more patients. So doing these mitigation measures are critical for the community, but you also don't want to be that person who needs an ICU bed when there's 0 ICU beds available.
Final question here from Melissa. Is there a chance Milwaukee is taking a look at implementing a new mask mandate for the mayor or commissioner?
Well, as we've talked about last week, the commissioner, maybe it was 2 weeks ago, issued an advisory. We continue to have conversations as to whether that meets our needs. I will say that one of the issues here, of course, is enforcement. And I've talked to officials in cities where they do have the mask mandate, and there's an enforcement issue there. So I don't want us to distract from what I consider to be the most effective tool, which is the vaccination. But again, we'll never rule it out in its entirety because it might be something we need to do.
Thank you, Mayor. Thank you, everyone on the call and media for the important questions. That concludes our briefing for today. And just a reminder, next week is our final briefing of the year, and then we will resume them in the new year. So thank you all, and we will see you next week.